Hi, I'm Lady Nwadike, and I am part of the Fairfax County Health Department team. We are in Black Maternal Health Week, so we wanted to host a conversation about this important public health topic as it exists here in Fairfax. So, today, here to educate us on the importance of Black maternal health is public health nurse Alysia Parker-Stephens. Alysia, thank you so much for joining us. We appreciate you.
Thank you for having me.
Absolutely. So, why don't we start with you telling us a little bit about yourself, please?
So, I work in the area of maternal child health here at the Fairfax County Health Department. I have been serving the southern region of Fairfax County for a little over 15 years, but I also am a mom myself.
Absolutely. Well, thank you for your service. 15 years is a long time. I'm sure you have helped numerous women and individuals through their journey to motherhood, and I'm excited to hear a little bit about that today. I'm sure our viewers are too. So, as I've stated before, it is Black Maternal Health Week, and I'm sure we need to touch on the current state of Black maternal health, but I think for Fairfax, it's important to define what Black is here in Fairfax. And so there's a historic population of African Americans here, but over the years, we have welcomed many different demographics that include African immigrants. Again, African Americans and others. So, in terms of the individuals that you see day to day, what does Black Fairfax look like to you?
You are correct. So, Black in Fairfax means women from the continent of Africa, Black American women here from the US, as well as the women who are born to African women too, and so African American community, and then also the women of color from Spanish speaking countries. So, it is vast and wide and diverse.
So there's something for everybody. And in terms of that, I think that it's important to state that we're still building relationships with the Black community here in Fairfax County. It's always a work in progress. And I think it's important to have conversations such as these because that definitely contributes to that. A recent report from the CDC on maternal mortality rates in the US was pretty grim, especially for mothers of color. In 2021, the maternal mortality rates for Black women were significantly higher than rates for white and Hispanic women. So I think that is a really great segue into our first conversation topic. There are a couple barriers for women who are seeking um, a medical home or a medical provider or just being healthy during pregnancy. So I'd like to start there. What are some of the barriers that you have experienced?
So it is sometimes difficult to have conversations as a as a woman about what type of care you would like, what you are seeking. So it's good to have in mind what you would like. There is not one way to birth or to experience pregnancy. You do have options. And sometimes, if you just have too many thoughts in your head, it would be good to write them down, and you can bring those to your healthcare provider when you once you find a healthcare provider too. So advocating, and also if you don't feel like you are heard when you're advocating for yourself, then you do have an option to switch to a different healthcare provider.
Absolutely, absolutely. I think it's important that individuals who are seeking care know that they can speak to their doctors. It's okay to have questions. It's okay to want more information about what's going to be pertaining to your health. So I think starting there and knowing that that is completely fine and should be part of a healthy patient provider relationship is really key. Um, and then you also touched on, if you feel as though you need a second opinion, it's okay to get it. You can go to different doctors, shop around, and if you find one that you really feel comfortable with, I think that's really a gem. But it's okay to feel like you need to get a second opinion. Do you have any tips for individuals when they have questions for their providers? How do they approach that in your experience that has been successful?
So, as I mentioned, writing down your questions would be good, or putting them, typing it in on your phone and bringing your phone with you to your appointments. But also, there are organizations and programs who can support you during this really important time of your life. There are home visiting programs like the ones that we have here at the health department, but there also are parenting support programs, some that are home visiting as well as classes too. And so, yes, doing a search on the internet is good, but also our coordinated services planning phone number that have here in Fairfax County, where that is just a general information line. You can get all kinds of information, not just pertaining to healthcare, but that could be a one-stop shop to find out what kinds of support are there to help me through this time. So that is another way to kind of have different ideas and information so you know which way to go.
Thank you. Thank you so much. So I think, in to summarize what we've discussed, I think self-advocacy is at the forefront. We must advocate for ourselves, and I think we've discussed quite a few ways that you can do that. But in addition, like you mentioned at the beginning of the conversation, keeping a journal with notes about your medical visits and any medications that you are on is a really good idea too. I think it's really empowering to be able to discuss with your doctor previous visits or maybe concerns that you may have had, so that you're an active participant in your care. So, thank you for those tips. I think that they're very helpful. One thing I'd like to ask is, for women, in terms of our experiences, sometimes they're not the best. But I remember you mentioned to me that you had a really great experience with your journey to motherhood. So, are there any things that you'd like to highlight that you took upon yourself or that you experienced that other women may use as a template?
I would like women to know that you do have an option in your care and you are a part of the team with your healthcare providers. I did have two out of hospital births with a certified nurse midwife, and they were great experiences. And I would like all women, if they're able and good health, also to have the type of experience they would like to have, whether that's hospital birth, out of hospital birth in a birth center, or at home. I want women to know that you have options and don't give up when things may not go well, too. And there really is support out here so that we can have success in our outcomes here in Fairfax County, Virginia, as well as United States.
Absolutely, absolutely. Um, And I think this is a great segue into learning a little bit more about the maternal child health program here in Fairfax County, especially for those who are seeking a medical home, as that's part of advocacy. Making sure that you are connected to services is really important so that you know where to go when you need something. So, would you like to share a little bit about the program and how people can find out more?
So here at the Fairfax County Health Department, we do have home visiting programs that is by a nurse. There are also other home visiting programs by trained professionals. Home visiting really helps you with building trust, making connections in the community, and learning more about how the community can support you as well as your family also. And so, again, the 222 number, 703 coordinated services planning is a way to find out about the multiple programs that we do have here. at the health department as well as in other county agencies. There is there are people, programs, and teams waiting for you to help you be successful and healthy.
Thank you so much. Thank you so much. I'd also like to highlight another program that we have coming soon called Stable Families Thriving Futures. And you can go to the website to find out more, but it is really focused on young families and giving them many resources to help them thrive. And I know that in the future, there will be more opportunities to connect with that program. So I wanted to highlight that here too. So more information will be posted about that soon. So we've talked a lot about advocacy. We've talked a lot about the journey to motherhood. We've talked about being Black in Fairfax and navigating healthcare. What are some of the things, the takeaway messages that you would like our viewers to remember after our conversation today?
It's important to take time for yourself mentally and physically and to be as healthy as you can be so that you can start out in pregnancy on the good foot and be healthy and have a successful pregnancy. Um, your diet, exercise, taking vitamins, and also too, if you this also means for your mental health also, not just physically, but also mentally.
Absolutely. Well, thank you so much for joining me today. It was a pleasure and an honor to interview you. And thank you for your service to all of our Black mothers in Fairfax County. And also, congratulations to all Black mothers in Fairfax County. Um, we hope to connect with you through our many programs. And again, Alicia, thank you for your insight.
Thank you.